Welcome to The Explainer. Today, we're diving into a really big question. What if getting sick never, ever meant going bankrupt? We're going to break down universal health coverage, or UHC, and try to figure out why some countries seem to provide healthcare for everyone, while others really struggle. And we'll do that by looking at three fascinating and very different examples: the UK, Japan, and India.
I mean, really think about that for a second. This single question gets right to the heart of UHC. See, this isn't just about medicine or building hospitals. It's a huge social and economic challenge that countries all over the world are trying to solve in their own way.
And this isn't just some nice idea or a hopeful thought. It's actually a formal global promise. It's right there in the UN Sustainable Development Goals. Target 3.8 specifically calls for achieving universal health coverage for all, and that includes protecting people from financial ruin when they need care.
Okay, so to really get our heads around this, here's our plan. First, we'll nail down what UHC actually is and look at the blueprints countries use to build it. Then, it's time for our deep dives into the real world. The UK's famous tax-funded NHS, Japan's super-organized insurance system, and India's absolutely massive and ambitious journey to cover its population.
All right, first things first. What are we really talking about when we say universal health coverage? You hear the term thrown around a lot, but the actual definition is both very specific and incredibly ambitious.
So the World Health Organization gives us this fantastic, clear definition. Now, here's a really crucial point. Universal health coverage is not the same thing as universal health care. Coverage means there's a system in place, like insurance or taxes, that shields you from those crippling bills. It doesn't always mean all care is totally free, but it does mean that your bank account shouldn't be the deciding factor in whether you get the help you need.
And check out the scope of this. UHC isn't just about fixing you when you're broken. It's the whole journey. It starts with things like health promotion and prevention to keep you well in the first place, all the way through treatment, recovery, and even making sure people have dignity through palliative care at the end of life.
So, the billion-dollar question is, how does a country actually make this happen? Well, to think about it, experts use a couple of really helpful tools, a concept called the UHC cube, and four main real-world models for how to pay for it all.
Okay, so this cube is a brilliant way to visualize the challenge. It breaks it down into three big questions every government has to juggle. First, you've got the breadth, population coverage. Who gets included? Is it absolutely everyone or just certain groups? Then there's the depth, service coverage. What's on the menu? Basic checkups, cancer treatment, dental? And finally, the height, financial protection. What chunk of the bill is covered versus how much do people have to pay themselves?
Now, to actually make that cube bigger, countries usually go with one of three main financing models. You've got the Beveridge Model, which we'll see in the UK, where it's all paid for by taxes. Then there's the Bismarck Model, common in places like Germany and Japan, which is all about mandatory insurance paid for by you and your employer. The third is the National Health Insurance Model, like Canada has, which kind of mixes them. It's tax-funded, but the doctors and hospitals are often private. The goal of all three is to get away from that fourth model, the out-of-pocket system where you just pay as you go. That's the one that leads to total financial disaster for so many families.
Okay, let's get into our first case study. We're heading to the United Kingdom, home of probably the most famous example of that Beveridge model, the National Health Service, or the NHS. The NHS was set up way back in 1948, built on this amazing principle that good health care should be there for everyone, no matter how much money you have. It's almost entirely paid for through taxes. So for people living in the UK, whether you're going for a simple doctor's visit or you need major heart surgery, there's no bill at the end. It's paid for by everyone for everyone.
Now, the biggest strength of this system is, without a doubt, equity. It ensures a high standard of care is available to all, and people spend very little out of their own pockets. But, and this is a big but, there are trade-offs. The NHS is constantly feeling the squeeze from budget pressures, and it's famous for long waiting times for some procedures and a real struggle to find enough doctors and nurses.
All right, now let's switch gears. We're going from a system that's all about taxes to one that's built on insurance. Let's travel to Japan, a country that's famous for its people living incredibly long, healthy lives. So Japan actually achieved universal coverage way back in 1961, and they did it using a mandatory social insurance system. Basically, every single citizen and resident has to be enrolled in an insurance plan, either through their job or through a community-based plan. But unlike the NHS, care isn't totally free when you use it. Patients usually pay about 30% of the cost, but there are caps in place to make sure no one faces financial ruin.
And the results? They're pretty incredible.
Japan has one of the highest life expectancies on the planet, and the government keeps a really tight grip on costs using a national fee schedule. But the system is under enormous strain from one of the world's most rapidly aging populations that's pushing healthcare costs up and really testing the long-term future of the whole system.
For our last case study, we're looking at a country with over 1.4 billion people that is taking a completely different and uniquely challenging road towards UHC, India.
India's story is all about its mind-boggling scale and complexity. In 2018, the country launched Ayushman Bharat, which is literally the world's largest government-funded health insurance scheme. Now, it doesn't cover everyone yet, but its goal is to give financial protection to the poorest 500 million citizens, mainly for hospital care. At the same time, it's also trying to build up primary care with new health and wellness centers.
I mean, the sheer scale of Ayushman Bharat is its greatest success. It's created a safety net for hundreds of millions of people who had nothing before. But the challenges are just as massive. Paying out of pocket for care is still painfully common, and there are huge gaps in the quality of care you can get between the big, wealthy cities and the poor rural areas.
So if we zoom back out, you can see that all of our case studies, and really every country, are facing some of the same big problems. Aging populations are a huge issue in Japan and the UK. A shortage of healthcare workers is a crisis in places like the UK and India. And the global rise of chronic diseases like diabetes and heart disease is making everything more complicated and more expensive everywhere. Really, the COVID-19 pandemic just put a giant magnifying glass on the weaknesses that were already there in every system.
But hey, it's not all doom and gloom. It's not just challenges. Technology and innovation are creating some amazing new opportunities to expand that UHCQ, to reach more people with better services, and to do it more efficiently than we ever thought possible. Just look at some of these examples. In Estonia, they have nationwide electronic health records that have made care so much smoother. In Rwanda, they're using drones to deliver blood and critical medical supplies to remote clinics in minutes instead of hours. I mean, this isn't science fiction anymore. It's happening right now, and it's helping to knock down those old barriers of distance and cost. So what's the bottom line here? It's that there is no one-size-fits-all path to UHC. As we've seen, some countries go the tax-funded route, like the UK, others use social insurance, like Japan, and some are building these enormous mixed systems, like India. The specific model might be different, but the core goal is always the same: providing quality care for all and doing it fairly. And in the end, this whole global conversation about UHC, from the highest levels of the UN right down to your local clinic, it all boils down to this one fundamental question. You know, the WHO Constitution actually declared health a fundamental human right all the way back in 1948. The journey to make that a reality for every single person on this planet, well, that journey continues today. Thanks for watching.